In this video, we'll go over 11 warning signs of liver cancer. Stick around because we'll cover 3 extremely unusual signs that you probably have never heard of. Liver cancer is a serious health issue worldwide, contributing to a significant number of cancer-related deaths. It's challenging to treat, but early detection can improve outcomes and treatment options. Being aware of the warning signs and understanding risk factors can be crucial in identifying liver cancer in its early stages. This video aims to provide an in-depth look at the warning signs of liver cancer, as well as preventive strategies that may help reduce risk. Liver cancer starts in the liver, a vital organ that processes nutrients, removes toxins, and supports overall metabolic health. Although it can affect people of any age, liver cancer is often seen in individuals with underlying liver conditions such as cirrhosis or chronic hepatitis. This type of cancer can begin in the liver cells, known as hepatocytes, and may spread to other parts of the body if not addressed in time. Here are 11 warning signs of liver cancer. One common symptom is persistent abdominal discomfort, particularly on the right side of the abdomen where the liver is located. This pain or discomfort might feel dull or aching and doesn't go away with time. It can sometimes be mistaken for other digestive issues, but when it's persistent, it may signal a deeper problem with liver function. Another sign to watch for is the unexplained weight loss. While weight loss can be a positive outcome of a healthy lifestyle, if it occurs without any change in diet or exercise habits, it could indicate an underlying issue, including liver cancer. This weight loss is often accompanied by a noticeable loss of appetite and feeling full after eating only small amounts, which can lead to further malnourishment and weakness. Fatigue is also a common symptom of liver cancer, often severe enough to interfere with daily activities. It's not the usual tiredness that goes away with rest, but a deeper, more draining sense of exhaustion. Along with this, many people with liver cancer experience generalized weakness, which can make simple tasks feel challenging. Jaundice is one of the most visible and telling signs of liver dysfunction, and it often raises a red flag for serious underlying issues like liver cancer. The yellowish tint of the skin and eyes results from an excessive buildup of bilirubin, a substance that is naturally produced when red blood cells break down. Normally, bilirubin is processed by the liver and excreted from the body through bile, which passes into the intestines and then leaves the body. However, when liver cancer disrupts this process, bilirubin accumulates in the blood instead of being eliminated, leading to the characteristic yellowing of the skin and eyes. The yellow hue of jaundice can vary in intensity, from a subtle tint to a more pronounced yellow, depending on the level of bilirubin in the blood and the severity of the liver dysfunction. In addition to discoloration of the skin and eyes, jaundice may cause itching, as bilirubin deposits in the skin can irritate nerve endings. This itching, known as pruritus, can be quite severe and unrelenting, significantly impacting the patient's quality of life. Please remember to like and subscribe if you are finding this information helpful. Dark urine is another notable symptom that often accompanies jaundice. As bilirubin levels rise in the bloodstream, it is filtered by the kidneys and excreted in urine, causing it to appear unusually dark or brownish, similar to the color of tea or cola. This change in urine color can occur even if the person is adequately hydrated, as it is not related to fluid intake, but rather to the concentration of bilirubin being processed by the kidneys. In some cases, jaundice may also coincide with the changes in stool color. Stool may appear pale, gray, or clay-colored instead of its usual brown hue. This change happens because bilirubin contributes to the brown color of stool. When liver function is compromised, bile flow into the intestines is reduced or blocked, depriving stool of its normal pigmentation. The appearance of jaundice, particularly when paired with other symptoms such as dark urine, pale stools, or unexplained itching, should not be ignored. It indicates that the liver is struggling to perform its essential functions, potentially due to obstruction, inflammation, or in more serious cases, cancerous growth within the liver. Jaundice often signals advanced liver disease, as liver cancer may need to reach a certain stage to cause a marked impairment in bile production and bilirubin processing. However, in rare cases, jaundice can appear earlier in the disease progression if a tumor obstructs bile ducts or blood vessels, causing a backup of bile within the liver. Anyone experiencing jaundice should seek medical evaluation promptly. Although jaundice can be associated with other conditions such as hepatitis, gallstones, or other forms of liver disease, its presence in combination with other symptoms like unexplained weight loss, fatigue, or abdominal pain may raise suspicion for liver cancer and warrant further diagnostic testing. Swelling in the abdomen can also be an indicator of liver cancer. Known as ascites, this buildup of fluid can make the abdomen appear distended and might be accompanied by discomfort or a feeling of tightness. Ascites occurs when the liver's functions are impaired, causing fluid to accumulate in the abdominal cavity. Nausea and vomiting, though commonly associated with many health conditions, can be a red flag when they occur persistently without explanation. As liver cancer progresses, the liver's diminished ability to process toxins can lead to symptoms such as nausea and a general feeling of unwellness. This can further reduce appetite, exacerbating weight loss and malnutrition. People with liver cancer may also notice that they bruise or bleed more easily than usual. This happens because the liver is responsible for producing proteins that help the blood clot, and when it's compromised, even minor bumps or scrapes can result in significant bruising or bleeding. Some people with liver cancer experience a back pain, particularly in the right shoulder area. This phenomenon, known as referred pain, occurs when the nerves send pain signals from the liver to areas not directly affected by the disease. In cases of liver cancer, referred pain is often felt in the shoulder area and can be a persistent dull ache that doesn't respond to typical pain relievers. Another potential sign of liver cancer is the fever without an apparent cause. This fever may be low-grade and persistent, indicating that the body is trying to fight off an internal issue. While fever can result from many things, an unexplained long-lasting fever can be an early warning sign of liver dysfunction. Finally, some individuals may experience mood changes or cognitive issues, sometimes referred to as hepatic encephalopathy. As the liver fails to filter toxins effectively, these toxins can accumulate in the bloodstream, leading to confusion, memory problems, and changes in personality. This condition often appears in advanced stages of liver disease, but cognitive changes can sometimes be one of the first signs that something is wrong. Reducing the risk of liver cancer involves a proactive approach to lifestyle choices, preventive health measures, and vigilant medical care. One of the most critical steps is to avoid hepatitis B and C infections, as chronic hepatitis infections are leading causes of liver cancer. Vaccination against hepatitis B is highly effective and is widely recommended for children, infants, and at-risk adults. While no vaccine exists for hepatitis C, preventive measures such as ensuring safe blood transfusions, using sterile needles, and practicing safe relations are essential. For those at risk, regular screenings for hepatitis can help detect and manage any potential infection early. Limiting alcohol intake is another key preventive measure. Heavy, chronic drinking can lead to liver cirrhosis, a known precursor to liver cancer, so reducing or abstaining from alcohol can significantly lower this risk. Tobacco use also poses a significant risk, as smoking contains harmful chemicals that can damage liver cells and increase the likelihood of cancer. Avoiding or quitting smoking is crucial for liver health and reduces cancer risk across the body. Maintaining a healthy weight is beneficial as well, as obesity and fatty liver disease are associated with an increased risk of liver cancer. Fatty liver disease, especially non-alcoholic fatty liver disease, is becoming a leading cause of liver cancer among individuals who don't drink excessively. A balanced diet, regular physical activity, and managing weight are effective ways to lower the chances of developing this disease. Environmental toxins can also harm the liver and contribute to cancer risk. Exposure to certain chemicals, like aflatoxins found in mold-contaminated crops such as peanuts and corn, can be dangerous. Proper storage of food to prevent mold growth, as well as minimizing exposure to industrial chemicals, can help reduce the risk. Diabetes and insulin resistance are also linked to a higher risk of liver cancer. Controlling blood sugar through a balanced diet, regular exercise and medications as needed can protect against liver-related complications. A diet rich in antioxidants from fruits, vegetables and whole grains supports liver health, while limiting processed foods high in unhealthy fats and sugars is beneficial. Interestingly, moderate coffee consumption has been shown in studies to reduce the risk of liver cancer and other liver diseases, as coffee contains compounds that can protect liver cells. Regular liver screenings can be especially helpful for individuals at higher risk, such as those with a family history of liver disease, chronic hepatitis infections, or a history of heavy drinking. Screening through blood tests and imaging allows for early detection of liver changes, which is essential for preventing cancer progression. Safe and hygienic practices are also vital in preventing hepatitis infections. Avoiding needle sharing, not sharing personal items that may be exposed to blood, and choosing regulated hygienic places for tattoos or piercings can all help prevent infection. Through informed lifestyle choices, regular checkups, and a commitment to liver health, individuals can significantly reduce their chances of developing liver cancer and ensure a better quality of life. In summary, liver cancer presents a range of symptoms that may often be mistaken for other, less severe conditions, which underscores the importance of awareness and early detection. Persistent abdominal discomfort, unexplained weight loss, fatigue, jaundice, and other changes such as dark urine, pale stools, and cognitive shifts are all signs that something may be amiss with liver function. Notably, jaundice serves as a visible indicator that the liver's ability to filter waste has been compromised, often signaling a more advanced stage of liver disease or cancer. Recognizing these signs and seeking prompt medical evaluation can lead to early diagnosis, which is crucial in improving treatment options and outcomes. Liver cancer can be challenging to manage, but with awareness, timely intervention, and supportive care, there is potential to address the disease more effectively. If you or someone you know experiences these symptoms, particularly in combination, consult a healthcare professional to explore appropriate diagnostic options. Early attention to these warning signs can make a significant difference in the journey toward better liver health and overall well-being. If you enjoyed this video, please be sure to like and subscribe. Thanks for watching.